if you're working in a medical field, that includes opticians, it includes dentists, it includes x-ray departments, A&E, things like that. If you have undertaken ASD, neurodivergent, or specialist training to help people on the SEN pathway, you might want to listen up, because this is some information I'm going to give you from somebody who is SEND, and also from a mother of somebody who is SEND, which, for those that don't know, SEND is special educational needs. But I've had multiple issues going on with this. I had a physiotherapist treat me absolutely appallingly. And when I actually did go through the pathway and make a complaint about this situation, and I pointed out, the reason that he treated me absolutely appallingly partly was against my autism. And he went, well, they've had specialist training in autism. You need to tell this practitioner at the beginning of your appointment that you're autistic, and then we can enact that training. Well, a big part of autism is a social communication difficulty. It's not just all the meltdowns. It's not just all the sensory bit. There is a huge element called social communication difficulty. Meaning, when I'm in that mindset of this is an appointment and I've got this going on with my health, I don't want to always keep telling everybody that I have autism. It's written in my medical notes for a reason. Now, I know most of them never have time to read the notes, but is that my fault? That they haven't got time to read something very vital that's written on the top of my notes? That I have to keep telling them I'm autistic, and even when I do, it goes in one ear and out the other because I'm not ticking what they think they're meant to be seeing. They're expecting to see a little 5-year-old boy that can't sit still, that's screaming, shouting, rocking and going mad. I'm not. I'm a grown woman who's had to mask all their life and has learnt how to focus and fit in. But in a time where I am in pain, I can't fit in. And we had this recently as well. My daughter, when she's in pain, goes quiet. Like really quiet. She goes inwards. I do the same. So I sat there once, and I will tell you personal history. I perforated my appendix. I walked to the hospital with a perforated appendix because the thought of getting in an ambulance, no. 111 was sending me an ambulance. No, not doing that. Don't like ambulances, don't like people touching me, don't particularly like it, but knew something was seriously wrong. The thought of a taxi and public transport, no, I walked with a perforated appendix to the hospital. And people will say it's not possible. It is. Agony, oh God, yeah. It took me ages, but you do. When you are in that sort of pain, you will do, because your autism isn't something you can just switch on and off. It's a big part of you. So if on a day-to-day you're going to avoid ambulances and public transport, when you're in extreme pain, you're going to avoid it even more extremely. I sat in an A&E in silence with a perforated appendix. I sat and then stood and walked around, but I was in silence. No screaming, no shouting, because if I kept it in and I kept it in, I could keep it in. If I opened my mouth, I was going to scream, and I don't like screaming because it makes people funny and it hurts my own ears. So I keep it in. And I sit quietly, and I'm silent. And I was silently going into sepsis. Within hours, I was in surgery, having major surgery to get rid of it and sort it out. If it wasn't for my husband and my in-laws that knew something was wrong, that might have been even more delayed. My daughter was at hospital with chest pains and was sat quietly. Chest pains and shortness of breath. And sat quietly for 6 hours until somebody had arrived to tell them, why aren't you doing something? They went, well, her pains are 0. She's here with chest pain and shortness of breath, so how can her pain be 0 if she's here for chest pain? Did you ask her? Well, somebody asked if she's in pain and she said not much. But she sat there for 6 hours, coming outside of her room in the middle of the night to an unfamiliar place where she was quiet, where she was struggling to cope, which was over loud, over noisy, and she endured it for over 6 hours, putting herself in the most uncomfortable situation when you already knew she was autistic. It had to have been higher than a 2 or 3 to put her through that. People on the spectrum don't feel pain like others. And if they are turning up and putting themselves into a very sensory place to get help, take it seriously. Don't expect them to communicate with you like other patients. They won't. They have a social communication difficulty. They will not communicate with you in the way you would expect. They're going to downplay everything. And if you see them wearing tinted glasses and you see the words autism, don't ask them to take them off. I had a patient, just take glasses off, everything's bright. This person tried to take my glasses off and shine a bright light in my eye. There's a reason I wear tinted glasses, my eyes hurt. Tell me what you're doing, explain it, prepare me. We're not kids with autism. We are adults on the spectrum. We are adults that need treatment in the correct way. And if you've already been given this training, use it. And for those giving the training, please educate these young professionals or older professionals or whoever it is you're training that it isn't just children with autism. It's 50-year-olds, it's 60-year-olds, 70-year-olds, 20-year-olds, 30-year-olds, 40-year-olds. All ages have autistic spectrum disorders and SEND needs. And the hardest part is that not all SEND needs are visible like some are. Now we know which ones are visible. But when you have ADHD, you have autism, you have bipolar, you have a lot of these conditions, Tourette's, you can't always outwardly see it. They mask, they control, but it will be written on their notes. Please think about this, people. Take care.